from Increasing Gloucestershire, and we're going to talk to you about our project, Your Health, Your Voice, Your Life. Yeah, we've been funded by the NHS to work looking at. Rosie, do you want to put the next slide on so we can say a bit more? So, yeah, I'm Sammy. I'm a project worker and an expert by experience or person with lived experience of autism. And Rosie.
Yeah, so I'm Rosie. I'm a learning disabilities nurse, and I'm also a family member of people with autism and learning disabilities.
And I think one of the things we're probably the proudest of is that we work together as equals. There isn't any hierarchy. We listen and learn from each other, and made it a really enjoyable project to work from. And yes, yeah. So we are Inclusion Gloucestershire. We are an all disability, all age, user-led organisation in Gloucestershire. We came out of Gloucestershire Voices and PING, which is the physical disabilities user-led organisation. And we have several departments. The engagement, which includes a number of our projects that you can see on the screen there. We have our hubs, which are our social and learning groups that take part during the week. People do courses and get together to meet up with friends and socialise, and sometimes we have early evening activities. We have 3 of those in Gloucester, Cheltenham and the Forest of Dean. We also have a BME, Black and Ethnic Minority hub, the friendship group, which is for people from from different ethnic communities. We have GEM, which is going the extra mile to support people into work and volunteering placements. People that are quite a long way need quite a lot of support into work. Carers that care, careers that care. That's to try and increase people to work in health and care work. We're working with the NHS on that one too. And we're speaking to people, both professionals and people who receive support or healthcare, about the difference that can make to people's lives. And then we're going to talk to colleges and schools to sort of encourage that career path. Mellow is our mental health part of our organisation, our user-led opportunities for people with mental health. And then we have, and then also the new part of engagement is the volunteers and advocacy project. There's a small team of 4 that just starting to explore how to fill in some advocacy gaps and build up a volunteer team within the organisation. Rosie might want to fill in any gaps on that one, Rosie.
I think you've covered that brilliantly, Sammy.
And then so we've got training and development, which we co-produce, co-design and co-deliver with our experts, our people with lived experience. And a lot of our staff at the organisation are people with lived experience, and I think that's really one of our strengths as an organisation. Training to healthcare professionals, and we've done some work for skills for care, and as part of that, we have a drama group who provide forum theatre to use that as part of our training and skill building. And the other department that you'll see there is quality checking, and Rosie would like to speak a bit more about that.
Yeah, so quality checking is where experts by experience go into places where people live generally. So it could be assessment and treatment units, or supported living, or residential care, and it's about finding out whether people are getting good quality support in the way that they want. And the last bit really is that we have a YouTube channel with a lot of the videos that we've made as well around various topics. Yeah, thank you.
So, your health, your voice, your life. We were asked to engage with the user groups around the Southwest about health messages, and obviously, like many of the projects, has been affected by COVID, and so what we did was we produced an easy read survey that we sent out as far and wide as we can. Hopefully some of you may well have seen that, either in Easy Read or on SurveyMonkey. We sent it out to over 200 groups, and we've had individuals and groups. We've had over 100 replies. We asked about being in a user-led group and about what they feel about health messages and how they'd like to engage. We've learned that people really do want to learn about health and want to be part of a user-led group. Yes, is it right? So this week, we're just finishing off our initial report, and putting into the document how we've learned from what people say and what will help them talk about health. And we really want to work with user-led groups in the Southwest, because together our voice is stronger, and I think there's a very strong need for people to have a strong voice about health, and we're learning so much, and we want to share all of that learning and learn from each other. And yes, yeah.
We were both messaging each other saying how excited we were to hear about the women's groups and maybe things that we can learn from that. So thank you.
So what makes us proud? Absolutely, we're equals, and we treat everybody as equals, and I think that really comes into the second point. You can see there that we're stronger when we work together. We've learned and we reflect, and that also makes us strong. The really good news there is that we got a year's extension for this project. Originally it was only meant to run from January to July, and now just last week we've got a year's extension, which is fantastic, and it really proves that the NHS is listening, but also we really want to build a really strong and user-led voice to the NHS around the Southwest.
Yeah, absolutely. They want us to be able to have that two-way conversation about health. So from the NHS England level, so it's good. We can all have an influence.
So thank you. And any questions?
Oh, thank you for your presentation, but I can help you link with the Southwest, because that's what I used to do. I used to work on the National Forum.
Brilliant.
I used to chair the National Forum. So maybe after this we can link up, and when I speak to my other colleagues, we can all do the linking.
So
Sounds great, doesn't it, Sammy?
yeah, no, it's great to be part of these groups and link up. So I sort of didn't mention the counties that the Southwest is. So that's Gloucestershire, South Gloucestershire, Bath and North East Somerset, Somerset, Bristol, Wiltshire, Dorset, and Devon and Cornwall. So any groups from that group, if they'd like to link in, that would be fantastic.
Yeah, well, I will have to check whether we're already linked to you before I say it again, because I don't know, because I've seen any of my colleagues recently. I don't know what we've been working on, but I do know I have my 2 managers are linking me through you lot, and they're still working. They haven't been furloughed, but the rest of us have.
Yeah.
So I haven't been able to do any linking really.
Yeah, I think we found that tricky with, you know, COVID and the lockdown and things. Originally, we were going to have 2 events, so we would have been able to talk to people face to face in different parts of the Southwest. But I think still it's good that we're able to make these connections.
Yes.
Yeah, I've just seen in the chat that, was it Mark?
Yeah.
Mark Brooks, yeah, thank you for saying about My GP and Me as well. I think we can maybe all link in together after this.
Yeah, no, we've done around health and well-being as well. We've done a lot within dimensions around all aspects of health as well. So yeah, and yeah, we could link you up as well with people that we know. But yeah, also around the GP surgeries, it's a shame we just got on momentum and we're just doing the second stage because we trained 50 GP surgeries free, so we were just doing the second stage of it, but looking at people's annual health checks, because we know in some areas people are still not getting them even with the lockdown.
Yeah, that's something we look at as an organisation quite a lot as well, through quality checking. And so there's a man called Simon Shurick. He's called a strategic health facilitator, but he talks to people in the NHS and people like us with the Userled Group. I mean, is anything more you want to add about him, Sammy?
Yeah, no, I mean, we have some very good allies within the NHS. Simon is one of our key ones, and he's very, very keen on the help of equalising some of the health inequalities, which our group really would, our work, we really want to work on that as well. I mean, even from the women's group, it was very clear that people want to talk about health, and I think and we did in Gloucestershire. We're very lucky that we have some very good allies. Simon particularly is wonderful. Is there anything else, Rosie?
I mean, I suppose a bit of a strange one, but if I could ask a question of people here, is are your groups for people with autism as well as learning disabilities?
Yeah, ours is learning disability and autism.
Yeah. Do you ever find that people want to have separate groups? Because some of our responses for the survey have said that most people who have learning disabilities are happy for it to be everyone, and there are some people that have multiple conditions that just really want it to be everyone with a disability. But then we found some people with autism say they want a group just for them.
Yeah, it's quite hard though, isn't it?
Yeah.
I don't think you should separate anyone really. I mean, everyone's equal in my eyes.
No.
Yeah. I think that's really important stuff to have said and to heard. So thank you.
Rosie, right? I'm from the Wirral, and I work with a lady called Jen who's on here today.
Yeah.
And we work with autism together, and people like that. We go like to offer our training to like people like self-advocacy groups, and I said to Rachel before, I work within CWP, which is Chester Hospital, and we, stuff like that.
That's very helpful, Russell. Thank you.
Sorry.
Rosie, can I just close the sharing the screen just so I can check no one's waving? Is that
You
okay?
certainly can. I'll just show you the thank you slide.
Yeah, I just wanted to respond, Rosie, that our group is largely for people with learning difficulties. We wouldn't exclude someone with only autism, but it wouldn't necessarily reach their needs. So I can totally understand the feedback you've had of separate groups, because it can be hard to be responsive to both needs at the same time, I think.
Yeah.
So we'd be very open to people with autism, but we haven't particularly reached out in ways we obviously do with people with learning disability.
Yeah, thank you, Jenny. And which organisation were you from? I've forgotten. Sorry.
It's My Life in West Berkshire, which is part of the advocacy people.
Great, thank you.
Naomi, I can see you've got your hand up.
Yeah, I wanted to ask a question to the whole group to get people's thoughts about how you talk about when things have gone wrong. So I was thinking about the Treat Me Well campaign we had last year, and I wanted to get people that I know involved in that, because somebody we know died in hospital and it went to court and the hospital was negligent, and how we talk about that, because other people were saying, oh no, if we say that then people will be too scared to go to hospital, they'll be scared to go to the doctor and they might get more ill because they're frightened. So it's that balance of talking about things and being able to speak up but not scaring people, and I'm not sure how to do it or what to do.
No, I'm not sure either, but I've also discovered that since COVID, anybody is afraid to go to the hospital anyway, whether you have a disability or not.
That's true.
I think that's all about the learning that we hope to do about sharing that information and learning from each other. That we might not have the answers, but I think working together we can get a strong voice and talking. As Rosie said, I think even just in the first presentation, we're both very excited about this group, and I went to Blackpool, and it's very exciting to have this sort of collaborative work. And I think that, our project is particularly for the Southwest, but I think even for a national, working together, it's very exciting. And
yeah, we as an organisation, our chief executive Vicky, who's an expert by experience as well, she was sorry not to be able to come here and definitely wants to link up nationally. I think we've all got a lot we can share with each other, but I think definitely our thinking now is as Kerry said, COVID's changed everything really, I think, and we all know that, and it's maybe a good thing to work together to respond to, or to do things right for everybody really. It's different now, and maybe we can learn from it and come through it and all be stronger for it, better together, as Leslie's just typed. Yeah.
I suppose we people usually have a 6-month review or a yearly view, and within that even though it's hard, we do like an end of life plan. So how we talk about, and then what people want at their funeral, so how they want to be buried.
Yeah.
So we do a lot of one-to-one talk and support people to go through that, even though it's hard. We try and support people to know, and if people are uncomfortable as well. But if they don't want to talk about it as well, that's fine.
Yeah, that's something we as an organisation talk to people about in quality checking.
Yeah.
We've just we've used this time where we haven't been able to go out to see people in their homes,
Yeah.
which is worrying, frankly. You know,
Yeah.
we are usually doing user-led quality checks to see
Yeah,
that
we've
people are
got
safe and happy.
40 people that do quality checking as well.
Yeah,
We do our own quality check.
there's that worry that places are getting a bit closed off, maybe.
Yeah.
But it's given us time to redo the way we do our quality checks in a really in a more user-led way, I would say, than we used to do them, which is very exciting. So yeah, and that's something we through all the research and talking to people found it's really important to talk about. Even though it's hard, it's important to talk about end of life if people want to.
People, like staff, don't want to scare people, but my feeling was that they weren't really treating them like grown-ups.
Yeah, and that's something that we're trying as an organisation. It's not the project we're talking about here, but the quality checking is trying to work with staff, as you know, supporting people so that they feel a bit more comfortable. And sometimes maybe some of our actions on the quality checking reports could be things like staff need more support to be able to talk about things that are difficult.
And I think we as an organisation are learning that as well. I mean, just last week we had a bit of informal training on end of life care and but also going back into this project. I mean, I've seen a couple of comments about health passports and end of life planning, and I think all of that sort of having a strong voice to talk to the NHS about that sort of thing, and working together like this or in person is incredibly important. And I think there are difficult conversations and we need to have those conversations, but
yeah, I think our feeling is
yeah,
everyone's kind of safer and healthier and happier if we can talk about everything, even the difficult stuff. And I think the presentation about the women's groups really showed that as well. It feels like a really strong thing here.
Kim, I think you had your hand up. It's gone now. Have you still got a question?
I did. I'd just written it in chat saying that just because there's things that we don't talk about doesn't mean that they're not happening. And my personal point of view is that it's better for people to have the information and be aware of what's going on, rather than, for want of a better word, shielding them from actually this is happening, you know, these things. So I remember when the Manchester bombings happened and we talked to people about what you would do if you were in that situation. Some people got really upset and I said, you know, I'm sorry that you're upset, but you know, somewhere this could happen. And by you knowing a little bit about it and having an understanding, it's going to help you if you were ever in that situation. Yeah. But also by not talking about it doesn't mean it's not happening. And I just think that it's the same with hospitals. You know, we know things go wrong, but we can give information the people the information they need. So hospital passports, checks, all those kinds of things. But at some point you might have to go into hospital and things might happen that you're not comfortable with. And is it better to have a little bit of information about it rather than not have a clue what's going on and think that everything's going to be absolutely perfect, there's no issues and that kind of thing? But that is just my personal opinion.
Yeah, I think that's
I think it's a general thing that people worry more about the unknown, don't they? So, you know, it's worrying about things that you don't know what's going on. The more that you get educated or informed about certain things, kind of more safer you feel, because you feel reassured. This is what I expected. This is what I was told. You know, we discussed this previously. So although I might be still a little bit scared, I'm comfortable that this is the right thing that's happened. Whereas if you just ignore things and you don't talk about things, and it's the fear of the unknown that gets to a lot of people.
And I
that
think that
shouldn't be
is
the
why
case.
there's a lot of health inequalities, is that some of the information in the NHS isn't accessible, or people are shielded from it, or whatever. And hopefully with this group, our project, and working with each other and working across, we can sort of really have that two-way conversation that people with learning disabilities and autism have the information in an accessible way, but also that the NHS is aware of the reasonable adjustments or the information they need about people with autism and learning disabilities. So it's that fear, you're right, it's that fear of the unknown, and I think a lot of our project is about trying to break down those barriers. But wouldn't you say, Rosie?
Yeah, absolutely. I think something else that is probably important to say is that it's been in our mind a lot that we haven't really engaged with those people who have more, if you want to use the labels, which I don't really, but I feel like I have to, people with more severe learning disabilities, maybe who don't use speech, or who show their views through their behaviour rather than language. And it's something that we think we need to focus on a bit more in this coming year. And we don't feel that we know all the answers to, but it's something we're passionate about getting right. So again, we'd really
I'd
love to
agree
link up
too,
with anyone.
because here in Dorset we also don't do that very well at the moment, because we don't know where they are to begin with.
Yeah, I think it's something that we've spoken about a lot, isn't it, Sammy? And I think it's maybe something that, you know, there aren't very many people getting it really right yet for that group of people. And, you know, obviously we want to be as inclusive to everybody. So I think just to keep conversations going about that is very important. And also, we just said seldom heard groups. So I know we said that we've got our BME hub, we call it. But I think, again, we could and maybe should find ways to join up with everybody in the Southwest around this, because there's a lot of potential to make a lot of positive change happen, and so it's really important to us to get it right from the beginning. Yeah, interesting, Jenny, that you're saying you can find that as well. Story sharing and open storytellers. Yeah, I've seen thank you, Naomi. I've seen quite a lot of stuff around that, and there's I don't know if anyone's heard of PMLD Link. And the PMLD standards.
Yeah.
Have you heard of those? They've really helped when we've been doing our work around quality checking and making it more inclusive to people who don't speak. Jan, I think that's a great idea. With those standards have helped us inform the redesign, and we've actually been able, the council have agreed that we can go and do quality checks with people in an experiential way, which means we might join in when staff are supporting them with you know, an activity they like doing, instead of asking staff questions.